Let's transition into our COVID update. We're going to have a new format starting the new year. We've heard from a number of members of the media and community who have asked us to streamline and cut down the presentation of data and charts. All of the data and charts that we have been showing throughout the course of the last year will still be available on our website. Will still be published in a very transparent way, and we're still happy to answer questions related to them. But we want to make sure that we reserve a significant chunk of time for question and answer, and so we're going to streamline that. I'll give a brief update. You'll hear from Supervisor Nora Vargas, who is the new member of the COVID-19 subcommittee. Our public health doctors are here for questions, and we wanted to be able to devote more time to the question and answer component of our press briefings, and so we hope this will help facilitate the sharing of information and the discussion that we come. As we begin a new year, it is a time for us in San Diego County to have a renewed focus on tackling COVID-19. The holidays hit us incredibly hard. We saw what happened with the surge surrounding Thanksgiving. We are anticipating an uptick in cases as a result of Christmas and New Year's. Based on traffic patterns and airline patterns, it seems that probably not everyone followed the public health orders surrounding the Christmas and New Year's holiday. And when you add on top of that, the precarious situation our healthcare system is in, the tremendous strain on our ICUs, the continued increase in cases, and when you add on top of that the presence of the UK variant, a strain of the virus that we believe is much more contagious. We now have dozens of cases in San Diego County. They are not connected to one another by relation or geography. It is also important to note that a very small number of positive tests are screened for the UK variant, so the actual number is likely significantly higher than what we are aware of. And all of those factors combined together force us to have to refocus our energy around the basic things that we know to do. It is a new year and we need a new focus, but the things we do to avoid COVID remain the same. Wear your mask, physically distance from non-household members, only leave your home when it's absolutely essential, and please go get your flu shot and get ready to get your vaccine for COVID. On the subject of vaccines, again, the vaccine system and the way they go out, we get a lot of questions around this. A lot of entities are receiving the vaccines directly and are administering them consistent with the tiers, and I'm going to review the tiers and where we are in the state of California and in San Diego County. Healthcare providers are getting vaccines direct. The Department of Defense, the VA, CVS is getting them for distribution, and the county is playing a support role in a safety net type work. And as the county, we are working as an air traffic controller to try and coordinate and integrate and work together in order to ensure adequate distribution of the vaccines. Invariably, it is going to be a bumpy path. It will be some bumps in the road as we go. But the good news is we are talking about vaccines, and people every day in San Diego County are being vaccinated. Right now, the focus of who is getting the vaccine is our healthcare workers and employees and residents of long-term care facilities. And I will walk you through a quick chart here that shows you where we are. So phase 1A is what we are vaccinating now. These are healthcare personnel and employees and residents of long-term care facilities. These are tier 1. Again, you see there acute care psychiatric hospitals, skilled nursing facilities, paramedics, dialysis centers, behavioral health residential facilities. These are all folks who are in phase 1A. There are 3 tiers to it. These are the only folks that are getting vaccinated right now. We'll take a second look here at tier 2 and tier 3. Again, this is the same phase 1A. Again, this is tier 2, intermediate care, home health care, in some supported services, community health workers. You can see the list of the individuals who are here. Essentially, all of phase 1A, all 3 of these tiers are now open for people to get vaccinated. What individuals need to do, if you fall into any of these lists that are up there, you need to contact your healthcare provider. Your healthcare provider, where you normally go to get your healthcare coverage or treatment, that'll be the entity that will be working through. And again, these are some large numbers of San Diegans, much larger than we have number of vaccines here in the county right now. Call your healthcare provider, and they will have in place a system to help you do it. And the county is working in a role to try and support and aid and assist our healthcare system. Once we get through this phase 1A, Then we will move on to the next phase, and we will keep you apprised of where we're going. We continue to work on collating the data of how many vaccines are here, how many have been given, and we certainly hope by next week to have good information. But there's a lot of entities involved. There's a lot of moving pieces. So we will continue to work through this. Every San Diegan should be prepared to receive the vaccine when it is your turn, and we will do everything we can to continue to coordinate all of the entities across our healthcare systems. I have been encouraged recently by actions around stepping up enforcement of our public health orders. There is no desire to be punitive, but the people who pay the price for individuals that are blatantly defying the public health orders are our vulnerable citizens and residents who are impacted and are losing their life, our healthcare workers, folks that are denied access to care because hospitals are having to make adjustments of who can come in and who can't. And the simple reality is our public health orders are only as effective as the broad-spread cooperation and compliance and the enforcement to ensure that. I want to thank Mayor Todd Gloria, who's been willing to step up enforcement in the city of San Diego. His efforts are appreciated. We are grateful. We continue to coordinate with the city of San Diego on each of these actions, and we are grateful for them. I also want to thank the Alcohol Beverage Control, who again has been willing to step up their actions around enforcement, around egregious blatant violators and potential super spreading events, and a number of other cities that are exploring different ways that they can be a part and assist us in the efforts to ensure enforcement. I talked to our enforcement team and got a rough sense of what we look at. As we have complaints come in, we evaluate those complaints, and we find that in general, about 90% of the entities come into compliance after an initial investigation or an initial contact. That is encouraging. Out of the 10% that don't, we issue a cease and desist letter. More than half of those who we issue a cease and desist or public health closure letter to do come into compliance after receiving that letter. The ones that are left are the ones that get referred to law enforcement for citation, and then either to the city attorney or district attorney for prosecution. And again, we appreciate everyone's cooperation as we work through the challenges we face surrounding enforcement and the very difficult situation we face with COVID-19. Now let's jump into our streamlined charts for today, and then we'll hear from Supervisor Vargas, and then we'll jump into your questions. All of our public health doctors are here for the Q&A and discussion part. You'll see here on the first chart today, we're reporting 3,815 cases. You can see over the last few days, the number of tests were down. That is a natural dip that came out of the New Year holiday, and we see those numbers ramping back up in terms of the number of tests today, 26,320 tests being performed. Again, the purple line there representing our 14-day rolling average of percentage of positive cases, 14% for the day, but you can see the trajectory over time. Again, that continues to go up. Next on our hospitalization chart, again, the numbers continue to go up. You see a slight bump in our ICU utilization. These are COVID patients in orange in ICU, the blue being the total COVID-19 related hospitalizations, and you can see again the numbers continuing to climb. And I just want to remind everyone that there is a significant delay, 21 to 24 days between a surge in cases and a surge in hospitalizations, and we expect the holiday cases to arrive soon and a corresponding increase in hospitalizations to continue certainly through the end of the month. And then the last chart here is our ICU availability. You can see on the bottom there, 384 is our COVID-related ICU census in our area's non-federal hospital system. 249 is the non-COVID ICU utilization. And we limited this chart to just a few days to make it easier to read, but if you go back on the website and look over time, you can see those non-COVID numbers have shrunk significantly. These are individuals that are having the care they need delayed or denied because they have to make space for COVID-related patients. The number in the box you see right there, 39, that is staffed and immediately available ICU beds for the entire county. And again, this number fluctuates day to day. Slight variant between how we measure that in the state, but again, it gives you a picture of the nature of the healthcare system and the challenges that our hospitals face today. With that, I would like to introduce Supervisor Nora Vargas, who is the new member of the COVID-19 subcommittee. She'll share a brief update, and then we will jump into your questions, and all of our public health doctors are here and available during Q&A. Supervisor Vargas.